Okay, we're here with Janice Grewatts now, and in the health professions, it's amazing to me, but you guys have about 100% job placement.
That is correct, and that is the surgical technology program here at Parkland College. All of our graduates that have sought employment over the past 7-8 years have obtained employment even before they graduate. There is a high demand for surgical technologists not only in the central Illinois area, but nationally as well.
That's amazing. So tell me what kind of stuff do you do? I mean, you guys are moving. You don't sit around, right?
No, we are very active. So we are in one of those professions where you're on your feet all the time. We work strictly in the operating room in the surgery department. So we are the ones that are organizing everything to prepare for a surgical procedure for a doctor. We hand all of the instruments, supplies, and equipment to the surgeon. We make sure that everything is accounted for and we're not leaving anything in the patient, and that we're anticipating what the doctor needs.
So I'm assuming this is one of those programs where you get a little lecture, learn about it, and then you're out there actually doing it.
Right. Our program consists of both lecture, lab, and a clinical component of the program. So we do a lecture, which kind of goes through all the theory of the program, of this profession, and what the job duties are of a surgical technologist. And then we practice all of the skills in the lab. And then after 8 weeks in the lab, we send you to clinical, where you actually have hands-on experience in real surgical procedures at local area hospitals on patients.
And healthcare is not going away anytime soon either, right?
You never hear of a surgical technologist being laid off.
Yeah.
So we are in demand, and there is plentiful job opportunities.
Okay, so we walked out of that room, and then we went up some stairs, which there's no reason to show you. There's probably no reason to tell you either. But now we're on the second floor with Robin Hayden. And so you're in charge of the medical assistant program.
Yes, I am.
Okay, so tell me what that is if people don't know.
The medical assistant program, a medical assistant actually is a liaison between the patient and their providers. So what a medical assistant does is basically they will work in outpatient areas, including clinics and sometimes outpatient surgeries. But they're responsible for getting the patient ready for their visit. They do vitals, they draw blood, they can do EKGs, they help with surgical procedures. They also give medications, from oral medications all the way up to giving injections.
Okay, so what kind of person excels at this kind of thing? What kind of personality traits do you need?
Attention to detail. We are working with patients. Sometimes they're ill patients, and we want to make sure that we do everything correctly. Another good thing to have is for somebody who is able to work with all different types of people, because we are in with a lot of different people and we need to make sure that we can work with them. Being flexible is huge, because not only may you be pulled to another department, but you may have an emergency that comes up and you're going to need to be able to adjust to the fact that that's an emergency and know what to do.
Okay, so once they get done with the program, then they become certified, I'm guessing, and then they're ready to go.
They take a national test. The national test will allow them to work anywhere in the United States.
Okay, so they're not going to have any trouble getting a job once they get done with it.
Currently in Champaign-Urbana, there's over 60 available jobs for certified medical assistants. Nationwide, they are predicting in the next 5-6 years, it'll be a 29% jump in the need for medical assistants.
Okay, and so this is a pretty good living too. I mean, you make pretty decent money.
You make pretty good money, and again, it's dependent on where you live. Of course, the metro areas, you're going to make more money, but then, the cost of living is a little higher.
Sure.
But it is a good starting point for a lot of our students who are maybe just not ready to do the RN program, but they can go from CMA to LPN and then LPN to RN, and it makes it a little easier transition for them.
Okay, so what kind of time commitment are we looking at here to take this class?
The time commitment is 3 semesters. We do a fall, a spring, and a summer semester. The summer semester is basically what they are doing is their clinical hours or their practicum, where they're getting the hands-on experience in a clinical area.
Okay, so if somebody was really interested in this program and they're still in high school and they've got, say, a year left, what kind of classes would you suggest taking to get ready for this?
Parkland College actually offers dual credit classes, and they are allowed to take one class, which is legal issues in healthcare, and the other one is medical terminology, which is a required courses for our certified medical assistant program. So if they could do that, that would be less that they would have to do going in as a freshman.
Let's just walk. Okay, so we're downstairs for surgical, then we're upstairs for medical assisting. Now we're back downstairs with Midge Same, and we're going to talk about respiratory therapy. Okay, kind of tell me what respiratory therapy is, if someone doesn't know.
A respiratory therapist is a specialty healthcare provider. We take care of patients who, for whatever reason, are having difficulty breathing. Sometimes it's an acute illness, an acute injury, like a gunshot wound or a knifing or an automobile accident. It could be an illness like a pneumonia that causes somebody to have difficulty breathing. It might be somebody who has chronic lung disease, emphysema, chronic bronchitis, asthma.
Okay, now, are these people, once they graduate, are they working out of a hospital mostly?
About 85% of the therapists today will work in a hospital. Other opportunities for a respiratory therapist are in home health for those patients who have chronic illness. So sometimes respiratory therapists are recruited to do medical sales. It's easier to sell respiratory equipment to a respiratory therapist if you have some understanding.
So then 5 semesters and they're done with the program and ready to work.
2 years, 5 semesters. We start in the fall, go straight through until 5 semesters later, graduate in May. We tell our students to consider their clinical rotations the longest performance-based interview they will ever have, and most of them will graduate with job offers.
Okay, so you kind of mentioned it, but job placement-wise, are they going to have trouble finding jobs after this, or?
Nationwide, there is a respiratory therapist shortage. Here in the Champaign-Urbana area, there's always an opening. One of our hospitals pretty routinely has agency, temporary help in-house, just because of the growth for the respiratory therapist in the area. It's a national credential, state licensure. So if somebody wanted to move to another state, that credential would go with them. They would just have to apply for a license in that other state.